Well, hello everyone. Welcome back to the Real Joy Project. If this is your first time finding us, well, welcome. If you're coming back to hear all about the current convo, you're right where you're supposed to be. We have some pretty cool people that are going to be on with us today. But first off, the Real Joy Project, myself is Nikki Johnsrud. Then I have Jenny Lee,
Hello, good
and
morning,
last but
everybody.
not least is Miss Shelby.
Hello, hello.
And our guest today is Megan Geitzen from Urban Unwind in Dickinson, North Dakota. And a few months back, I was able to have her at one of the events. You guys have heard us talk a little bit in the Real Joy Project at times about the girlfriend getaway. And she presented Pause on Menopause at one of our recent events, and women went wild over it, including myself. And Jenny Lee was there, and so many women felt heard and seen and had lots more questions and wanted to know who, what, when, where. How do I figure things out? I'm not feeling myself, or I'm not quite there yet, but I know somebody that might be. And what about when I get there? So we asked Miss Megan to join us today and tell us a little bit about what she knows and how she helps her clients. She's a nurse practitioner, and I think I'm not going to steal her thunder a little bit. She's had some of these same things go on in her life. And I don't know about you, but when someone else shares their story and they share about what has happened for them, or maybe somebody they know, it really hits home, and we feel more connection, and we feel that sense of belonging, like, oh, me too, or I'm not alone. And so I hope that you guys enjoy this and follow along, and we'll give you all the information where you can continue to follow us at the end. But I'm going to hand it over to Miss Megan. And of course, the three of us are going to have questions for her as she goes on through. I can't keep my mouth shut for a full 60 minutes. So, I mean, maybe it won't be that long, but we'll definitely, add in some information and our journey. But Megan is my personal person that I go to for menopause. Perimenopause took part of my life about 11 or 12 years ago, and it was like a shining light that came into my life when I found Miss Megan. So hopefully she can shed some light on some questions that you have, and we'll go from there.
Awesome. Well,
Yeah.
thank you so much for having me on. First of all, I think most of our um my responsibility is to show everybody what perimenopause is and menopause as a provider, and especially because it just doesn't get talked about very much, and if it does, it's really on the hush hush, or it always involves a cancer scare with it, and that doesn't necessarily need to be. We have a lot of work to debunk a lot of those myths and to remove that stigma. So I appreciate you bringing some light to it.
Hmm.
Yeah, well, just a little bit about myself. My name is Megan Geitzen. I've been a nurse for 18 years, like she said, an NP for 8 of those. I spent 4 years in primary practice. A lot of my patients did come over for women's health. Always have had a passion for women's health. It just kind of came naturally to me. And when I was working as a primary care provider, I was right down the hall from a compounding pharmacy that natural or specializes in natural health and women's health, and they do a lot of bioidentical compounds, and just really trying to figure out what is going on with women in all the way from 20s all the way up to 80s, and just really the whole lifespan as much as we can, and the most important part of our lifespan, of course. So yeah, they would just send me a bunch of their patients, help me develop a practice geared towards women and our really complex hormone system. So suddenly I just had, all of these patients, and I know that you guys can relate to this. All these patients come in with, I'm so tired. I can't sleep. I can't think. I don't want to have sex. It hurts when I have sex. I'm so anxious. My joints hurt. I annoy me. I hate my husband. I hate my kids. All of the things, all jumbled up into one. And really, it's just all these vague symptoms that have a really specific cause. So it was kind of an eye opener to me as my early 30s, really just recently graduated and out of an acute emergent nursing experience into a more vague chronic conditions. in primary care. And so it was kind of a shock to me. I was just kind of like, why are these women, these middle-aged women, why are they all just really unhappy with the lives that they prayed for? It was just like, where is this coming from? So I did a lot of investigation. Me and my friends at that compounding pharmacy just kind of talked a lot about it. They sent me to some hormone conferences, and it just really opened up my eyes up to a world that I really didn't learn about in NP school. I mean, you touch maybe a unit on it, and that's about it. And it was mostly like, oh, they're gonna suffer, and that's the end of that. And I don't think that's okay. And obviously, how can I tell a patient sitting in my chair that, yep, sorry, you're just gonna have to suffer, just like we did through puberty, just like we do through childbirth, just, like the entire life. That's not the answer. So I did find some answers, and I found out that the good Lord above, he let men have the nice, really smooth hormone train, and we're on the fastest roller coaster of our lives with up and downs and everything in between for all of our life, really. So we don't ever get to be in a really steady state. So um, yeah, this talk we kind of are just gonna go talk about everything involved, right? So we're gonna learn about the symptoms, the answers, and what we can do, who you can see, and what things kind of mean, why you're not sleeping at night and why you're waking up at 3 to 4 in the morning every night, what that means as far as our hormones. So after this, hopefully you'll be able to tell your boss and your regular doctor, your husband, a regular random stranger on the street that you're not crazy. There is a reason that we are acting a little bit crazy, but there's a reason for it. So it'll be a nice little lesson on how we can improve the quality of our lives. So um,
And I was just
yeah,
going to add that, Miss Megan. I was going to say, I remember for me, when I came to you first, I had already seen several other providers. I'd seen one that towards the beginning of that I was struggling, and I had my husband smells, and he didn't smell, but he smelled off to me, and I didn't want to
Mhm.
look at him. I didn't want him to touch me. I also had the itching ear, which, like I always said, if I could have
Yeah,
been a dog, would have got right in there. And then other people, then that person left. Then I went to others, and I just thought I had to suffer in silence. Like I didn't
yeah,
realize that these were, just put your head down and just do the things. And then fast forward, finding you, and then sitting down and saying, I've done the things. I work out every day. I try to be on a good sleep schedule. I try not to, I'm not going out and drinking 4 bottles of wine every night,
yeah,
things that are going to affect some of those things. I was like, I think the thing I said to you is I just don't feel like myself. I don't
Mhm.
feel like I'm supposed to, but I also then felt bad about wanting to feel 100%. I remember saying that to you too. And
Yeah,
I also was thinking, well, I know I couldn't get this middle section of fat, visceral fat off. And I was like, I'm doing all the things. I also knew that probably could be affected from the grief that I was experiencing after losing our daughter. So it was a lot of those things, but I felt I had done all the things that I was supposed to do and nothing was helping. And so I felt lost. And then I was like, well, maybe I'm expecting too much. Maybe I shouldn't want to feel 100%. And then I remember even in the office with you, I was like, who the hell says I shouldn't? I'm like, damn right I should be able to feel 100%. And, actually, JennyLee and I've talked a little bit about it, not a little, a lot, about I am, I would say now, after a year working with you, I feel probably 95 out of 100. And that is, and I know we haven't even gone through all of the things that you're going to go through, but I think the other thing is we're not often looking for a quick fix, but we've been in this uncomfortable stage for so
yeah,
long, we just
yeah,
feel like, well, I guess it is my plight. And so that's where we really wanted you to come and start to talk about it because it
yeah.
has been such a taboo topic for so long. I mean, I'm gonna say this, Jenny Lee and I talked about it. It's easier to tell people who you voted for the president than it is to tell them that you're on hormone
Hormones.
replacement therapy. I mean, we said that to each
Mm-hmm.
other. I think that was Jenny Lee's line, so I stole it from her. But I was like, so true. This is so true. And
Yeah.
so now, realizing that we're not alone, that other women are going through this, but also feeling bad for our mothers, our grandmothers, our
Yeah.
aunts, all the women that went before us that they
Mm-hmm.
had to suffer.
Yeah.
And if there is something out there, now we're not saying everything is for everyone,
Right.
but I love how you're going to talk about it and share it with them because it starts to get in your mind about how to think about how this may affect us. And I think I remember you saying, I'm going to treat the symptoms, right? I'm going to treat the
Mm-hmm.
symptoms. And we looked at our labs and all those kinds of things, and we come back and we readjust. And I think it's, you know, nothing could, I don't want it to sound like that, but sometimes we feel like nothing can be easy as a woman. You know, it's like, geez, we have to have the complex, like you said, the men got the like, and we're like over here going up and down. And it's not necessarily
Mm-hmm.
always that we choose that, right? But this is, I love how you explain it because I had that aha sense, like, oh, now it starts to make sense as to
Yeah.
I'm not trying to be a be, it's that all these emotions, I just had that last night, not as big as they used to be, but I then was able to think, okay, what are some of the things that are going on and how could this be affecting me? And that some of those, our hormones really can flux.
Yeah.
Yeah.
Yeah, they do. I mean, I think I just really want to pinpoint like we treat at here at Urban, especially me, like my motto, and I have two other MPs that work with me, and I've trained them for it to be their motto as well. But we don't treat labs. I saw online the other day that it said my thyroid is normal, and I thought that was a hilarious shirt because yeah, like that's what we get all of the time as women, right? Like
Yeah.
maybe it's my thyroid. No, your thyroid's normal. Well, you're still having symptoms, right? So like just because your labs are not, I mean, in medical school or NP school, we are just trained to have evidence as to why you have a certain condition or how we can diagnose you with that, right? But I think we've gone astray from listening to our patients and hearing out their symptoms. And yeah, my motto is we don't treat your labs, we treat you.
Mm.
We listen to you, and although your labs may show that you're normal, your symptoms are telling me otherwise. And whether that is, I mean, our hormones are so connected in this like crazy cascade, right? So one will affect the other while the other one will affect the other. So it might be multiple hormones at once, and we might have to tailor and adjust month to month or, every 3 months. But we're gonna do it. We're gonna be on that right track, and hopefully we're gonna test it out and see how you feel because there's no reason, like we said, there's no reason that we can't expect to feel 90 to 100%. I mean, we just get that. We've got that our whole entire lives, which okay, right? We are the ones to have that monthly friend come, and we are the ones to give birth and bear all of that. That's great. It is a beautiful gift from God, but like we also don't have to be miserable the rest of our lives, right?
Yeah. Yeah.
So
Yeah.
yeah, I hope that I'm so glad to hear that this is a helpful picture of kind of our hormones in general because it's one I relate to the most. We've all been to a party. So I'm gonna kind of explain hormones like they are at a party, right? So all of our hormones are taking on this persona. So I want you to imagine a group with big personalities, each with a specific job. Each one shows up, does their part. The night is fantastic. There's good energy, clear conversation, easy, joyful vibes going on, right? But then when one person leaves or one person gets tired or one person takes over that playlist, suddenly it's hot, it's tense, and someone's crying in the bathroom at 2 a.m., right? So we've all been to those parties. So tonight I'm going to introduce the six key guests to our parties. So one is estrogen. She's our glamorous hostess, right? She's the hostess with mostest, carrying those cocktails. Progesterone is her best friend. She's the chill one in a cozy blanket. That would be me, at least this time in my life, right? Testosterone is next. She's our hype woman. She's got high energy. She wants to bring the party. Our next one is insulin, our bouncer. He controls the flow in and out of the party. Cortisol is our worrier, right? So that's the one like peeking out the window. That's the one that will go highs and lows and take us kind of on that roller coaster really easily. And then the last one is the thyroid, and I like to think of her like the DJ. She sets the tempo for everything, whether it's going to be fast or slow or the right kind of mix, 90s on nine, whatever it is, it's going to be a good party. So yeah, we'll kind of connect all these symptoms to each guest. And then you can kind of map out what you're feeling, like what's happening with you. We'll also talk about options, including lifestyle changes, hormone therapy, and that just kind of keeps our life beautifully balanced, right? We got to do one with the other. It's not just medications, it's not just lifestyle. It's got to go together. So yeah, we'll kind of start with the star of the show, and that's estrogen. She's the hostess with the mostest. Like I said, she does the lighting, the music, the mood. She's the reason that the party feels welcoming, right? Um, she in the body, the estrogen supports like normal brain function, skin and hair, bone health, urogenital tissues. When she's present, it tends to feel socially lubricated, like emotionally steady, cognitive sharp, and physically comfortable. And that just kind of leads me back to you, Jenny, or I'm sorry, I think Nikki said it, but we're and our grandmas, right? So they kind of took away a lot of those hormones, like in our grandmothers and our moms' um, lifespan, and all of a sudden we had this huge rise in dementia. Well, that's because estrogen actually is a protective function and mechanism around all of our brain cells. So once we brain cells go with them and they're gone, we don't see them ever again, right? So having estrogen on board is going to help us remember those things that we may need a list, of course, still, right? Because we're all moms and we're all busy, but that's why we can't remember things so quickly, is because that estrogen is lost. So when estrogen declines, especially in the menstrual transition, like the room feels hot and dry and the vibe just gets kind of a little awkward, right? So clinically we see that with hot flash is a big one right off the bat. Brain fog, irritability, and joint aches. So it kind of affects, I mean, estrogen is everywhere, right? But the good news for a lot of people is that appropriately prescribed estrogen therapy is like genuinely life-changing, right? Like it will put that pep back in your step. It'll make you feel more like you. And we individualize that. We have the ability to individualize that per you, right? So we picked on everyone's specific circumstances and history and risks and all of that. So um, my favorite are the patches. They have the least amount of risk involved. We always worry about blood clots with oral estrogen, just like with birth control and things. We worry about that. And then vaginal estrogen, I typically will use that when we have some vaginal dryness. Right. So I like to mix the patches and the creams together. So, we want to work systemically with the estrogen, and then the vaginal cream will just stay back. It won't go systemic. And we get a lot of questions about that from the pharmacy. They haven't quite caught on to that quite yet. But yeah, it's okay to do both of those. If you have a lot of urinary tract infections, if you have a lot of yeast infections, pH imbalances, it's because we're lacking estrogen there. So that's why I like to go ahead, put on that vaginal cream right away while we're working systemically to help with that on the back end too. Yeah. So now every hostess needs her best friend. Again, this is my favorite now that I'm in almost my 40s. So progesterone is the friend who arrives with that cozy blanket and says, let's just wind down, right? So she smooths the edges, she supports sleep, balances that estrogen on that uterine lining. So if you're on systemic estrogen, we always need, and you still have your uterus, right? So like estrogen makes that uterine line thicker, right? So thicker for our pregnancy, where our progesterone will come along and kind of shed it for us. And then so it doesn't get too thick. And that's what it's supposed to do in a normal woman who is still cycling. And so we kind of mimic that. So if you are still losing, or if you've lost your estrogen, you still need that, and you have your uterus, we will automatically put on progesterone. So that way it will keep that lining from getting too thick. Basically, it's not that you're going to shed with it, but it's gonna keep it from getting too thick. But for women, I get this a lot. For women who have had a hysterectomy, that doesn't mean that you don't deserve progesterone, right? So it is still a balancing act. We still need to add on progesterone so you can sleep, so you can be chill, so you can wind down at night and not be just a frantic mess all night long, right? And in the daytime, it's just this vicious cycle that happens. So I generally like to add that on so that women feel a little more balanced. We get that a lot from primary care after they've gone to primary care and then they come back to see me for a follow-up and I have them on both, but they've had a hysterectomy. The primary care will want to take them off because they don't technically need it. Okay, we don't need it for the uterus, but we need it for our brain,
Yeah.
right? So
Yeah.
yeah, we got to treat the skin. Um, yeah, and then we will always use micronized progesterone. I usually like to do the progesterone capsules, and we do that at nighttime because it's a bedtime pill, right? So it's going to make you relax. It's going to calm you down. Some women who, when they first start it, they almost feel like they're a little drunk. They're a little loopy and they want to go to sleep, but usually it'll work itself out and it'll just kind of calm you down, or I have you on too high of a dose, one of the two. Um, but yeah, I like the micronized oral progesterone because people, you know, think when they're going to go to sleep to take their sleep time medication and it works appropriately. Studies also show that it has the appropriate or an adequate uterine lining protection. So when you do have your uterus, it is enough to make sure that estrogen isn't building that lining. And then if it does, estrogen building lining can equal to cancer. So that's why we're worried about that.
Mhm.
And as always, we dose and we personalize the dosing and the timing and the route of administration as well, along with the histories and goals of the patient.
JennyLee, what were you gonna say?
So yeah, I was going to step in too. So I am also a patient of Megan's. It's been a year and about 4 months. I just added it up in my head. And
Oh,
I was doing how I kind of got started on the hormone path was I was doing pelvic floor therapy with another lady, and she had asked me, she's like, I'm just going to ask you this, and if it's, I'm not saying you should or shouldn't, but she's like, have you ever tried hormone replacement therapy? Because obviously, we start having some bladder issues, and I'm like, I don't want to be peeing my pants all the time. By the time I'm 80, I don't even know what I'm going to do. And I was
yeah,
like, well, when she asked me that though, I was like, that's bad for you. Like, why would you even ask me that? She's
yeah,
like, well, that's why I'm not saying you should or shouldn't. She goes, if you should talk to your doctor about it. She kind of left it at that. But I was like, I'd always heard that it's scary
mhm,
and because we grew up in the 90s and that's when it was all like, oh, it's horrible. You shouldn't do it. You're going to get breast cancer if you even think about estrogen.
yeah,
And
yeah,
so
yeah,
so then I had a friend that sent me a podcast. Dr. Mary Claire, who I know that all of us have listened to before, is like a huge advocate for women's health and hormones. And so I listened to
mhm,
her and then I scheduled an appointment with you. And I can't even remember now who told me to go to you. I don't remember. But um, when I came to you, everything I did a ton of research before I came to you, and everything
yeah.
you said was like what I was learning. And so that alone, like,
Oh, good.
just validated my feelings. And you were
Hmm.
so easy to talk to.
Oh,
And I
good.
walked out of there telling my husband, I'm like, I mean, my husband was just like, go for it. Because
Yeah.
my brain fog had got so bad. That was one of the most powerful things for me that he literally was concerned. He's like, I think you might need to see a doctor. Like, he's like,
Yeah.
really worried about me,
Mhm.
along with just exhaustion and same thing. Couldn't lose weight, doing the things. It wouldn't budge. It was going up, if anything. And it was such a struggle. And like Nikki said, you just don't feel like yourself. You're just like,
Yeah.
you don't feel like yourself. But you validated all of that and made me feel good. And then what I was going to say is I was so skeptical, started on a little low dose of estrogen and a little low dose of progesterone. And
Hmm.
that progesterone was a game changer. And then I
Yeah.
remember telling you, we started with just 2 weeks on, 2 weeks off at the time.
Yeah.
And I was like, man, those 2 weeks I'm feeling good. I said, but the other 2 weeks I'm crashing. And you're like, okay, let's level it out. And then I remember coming back, I'm like, I'm feeling so much better, but I'm still a little tired, but I'm sure that's just normal because I'm 47. And you were like, you don't have to feel like that. Just like you said earlier, there's no reason we have to feel blah.
Hmm.
So we
Yeah.
changed it again and it was like boom, there it was. And the number one piece of advice that you gave me, that I took as my number one piece of advice you gave me, was to be patient. And you said
Yeah.
it's going to take time to find where you personally need to be. Your friend could be doing this and that friend's doing that. And
Mm-hmm.
I remember thinking, I have felt like crap for years, so I can be patient for a little while till
Yeah.
I figure this out. So that progesterone to me was a game changer with the estrogen.
Yeah.
And my anxiety, I am actually taking half the dose of my anxiety medicine right now that I was, and I'm working on getting off of it. I mean, that's a cool feeling. I
Yes.
have
Yes.
nothing
Yes.
against anxiety
It's so
meds. I've
cool.
taken them many
Yeah.
times in my lives, but to realize that right now it's not the anxiety med I need, it's balancing my hormones.
Yes. Yes.
Yeah.
Yeah, I
Yeah.
think that is such a good point. I mean, whenever I was in primary care, I would have those women coming to me, and they're not sleeping. So I put them on a sleeping medication. They have really bad anxiety. So then I put them on an antidepressant, anti-anxiety medication. They're having palpitations. Palpitations is a very
Yes.
common side effect of low estrogen. And so then they would go on a blood pressure pill or a heart rate monitor or a heart rate regulator. And it's all because of hormones. It's like we can replace all of those things with just providing our body what they already had. And when we go through perimenopause, so perimenopause obviously starts first. It's about, and I kind of talk a little bit about this more, but it's about 15 years before your body is already set to go into menopause, right? So like hormone therapy doesn't put you in a menopause or like it doesn't do anything faster. It's still according to your brain. It's still whatever your body is already set for. So then your progesterone starts to just slowly decline as you're perimenopause. And that's why the anxiety is big high, because progesterone is our calming agent, right? She's the girl that wants to just wind down. We then when we go through menopause, right? That menopause is that one day where estrogen just drops, right? So once we go through that, then we need everything on board. Perimenopause, that progesterone's declining, that estrogen is just doing this all day long, all cycle long, just going erratically all over the place, which is why we feel erratic. And we don't feel stable because of that estrogen. And so, yeah, what we typically do at the beginning of perimenopause is to point towards the progesterone therapy, because that's the main issue, right? But there are studies out now that are showing, even though our progesterone is coming down, we maybe fix it with a pill to bring you more like steady. Our estrogen is doing this. We should be putting a patch on earlier, depending on your symptoms. So that way, although your estrogen is increasing, it's not bottoming out anymore. So yeah, just like you said, even though you're still cycling, we can still add on those things, because now we're having that data to support it, even though, like Dr. Marie Claire, all these women have noticed or known for so many years that, treating the symptoms is much more important than the labs. So, or guidelines on that matter too. Guidelines are just there, they're to guide us. They're not to make that decision for us. So, yeah,
Yeah,
that's a great point though.
absolutely.
Hmm. Yeah. So, our next one is that testosterone. So she's our hype woman, and I don't think she gets enough credit. Testosterone is our energy. It's our drive. It's our confidence. It's that let's go momentum, In women, physiologic levels support libido, our motivation, that muscle lean mass that we all crave. So when levels are low, all of that goes down. So our desire for intimacy and for sex goes down. Lower energy, there's less progress in the gym, just not any oomph for the day. So yeah, I mean, we don't give women, excuse me, enough credit for testosterone. We need testosterone in our lives. And yeah, although it's not elevated, we're not trying to become men, of course, but we do need a little hits of testosterone, and most women like that total testosterone level between 20s and 30s. And I promise you, every single woman that I've had is always below that, especially at this age, the middle age life. So it's great. So for carefully selected patients, we have some that are not good candidates for testosterone. Some women with like metabolic imbalances like polycystic ovarian syndrome, that automatically comes with a high testosterone. So then we have to balance out that testosterone in other ways, so we give them a blocker basically versus a high testosterone. So yeah, carefully to selected patients. Low dose therapy is a game changer. We treat this thoughtfully, like we talked about. We keep the doses within physiologic ranges, and there's so many ways that we can do it. My favorites are the and the creams, and I usually go through Ersfeld Compound Pharmacy here in town. They are they're my and they really help me to tailor as well. So the troches, that's just a little glycerin type of tab that you put right underneath your tongue. I really like that for women who still have like little kids around and little babies and things like that. Because in that way, it's not transferred onto little kids that want to sit up and things like that. But I don't get as good of a clinical response than I do with the cream. So my favorite are the creams. You just rub them on once a day, right in the morning. You know, it's alcohol based. It rubs really quickly. You just put it in between your thighs or behind your knees. And the reason we want to put it there is because again, if we just don't want it to transfer onto any kids, if kids are in the house or grandbabies, whatever it is. Keeping it in the least contacted place, and then obviously washing your hands after is really important. Um, but yeah, we get the best from that. We also have injectables too. I don't use injectables too much just because it is hard to calculate. And and there's just such a fine line between getting too much and not enough. So I like daily applications where testosterone is basically just twice a week. So but of course, like I said, we individualize it for everybody, right? So it just because it's not my favorite doesn't mean I don't use it. I don't I'm not biased like that for my patients. So okay, insulin. So insulin is our bouncer, right? He's the one that lets the flow in and out. He controls everything at a steady rate. And the reason he's important is because he fuels our body at the appropriate pace. So yeah, I mean, like it makes the party manageable, right? So if we have good glycemic index, we're not getting hangry. I know that we have all experienced that before. And it doesn't lead to surges and crashes. So like there are cravings, we will get like when the door is overwhelmed or unresponsive, we'll get just this overload. So we'll all get overwhelmed. We get a surge and a crash that leads to cravings, energy dips, afternoon slumps. So it's kind of the party equivalent of everyone like rushing the door and then leaving 10 minutes later, right? It happens so fast. And we feel it, right? That's why we're hangry. That's why we get once we get our blood sugar drops, and that's why we have so much energy when it's a spike too. So um, the bouncer, what helps that bouncer do his job, right? So the main thing here is lifestyle changes. We have a lot of medications, and I'll talk about those in a second, but our main thing that we need to do despite any medication changes, whether that be supplement or prescription, is get a stable glycemic index, right? So for instance, there are a lot of these little monitors out there that you can get. It's called a continuous glucose monitor. So I call them like your wearables. So, like your watches, you can get those there. But this one is really specific where it's a patch that you put on the back of your arm and it checks your glucose, your blood sugars about every 5 minutes throughout the day. So then like, okay, the protein shake I just had is causing me a spike and a drop. Well, I don't want that, right? Because spikes and drops hold on to weight, which then worsen our cortisol, which then leads to all of that belly fat, which then leads to hormones that aren't regulated enough. So this is where, I mean, this is almost key to anything that we're doing. So yeah, those real-time monitors, they're pretty cheap too. I tried to get samples for my clinic, but I think they know what I'm doing with them. I'm just going to hand them out just for funsies. So, yeah, they're not sending me to them, but you can get them for pretty cheap. I mean, stilo.com is one of my favorites. It's $159. You get two samples, or two sensors for that, and each sensor lasts about 2 weeks. So this is huge. Like you can go in and adjust your meals and what you're doing for that based on what your levels are. So for instance, I had a patient who was eating berries in the morning. She's always told berries, they're antioxidants for her, all of the good health benefits. Well, yeah, that's great. but they also have a lot of sugar in them. So we need to make sure that we're bringing down that sugar content by mixing it with something like protein, right? Like a good protein and a fat. So as soon as she added like eggs onto the game and like maybe, like I think she added a avocado toast or something like that, her blood sugars just completely leveled out and she had no more crashes. She had nothing else going on. So it is such a simple game changer like that. You know, I
Mhm.
I every morning I get up and I have a protein shake. And I notice the protein, but I can't make my own because I don't have enough time for that. I'm all about a certain protein shake and I that was spiking my sugars. So I had to pair it. I paired that then with some protein yogurt and that helped to stable me out, right? So like just by simply looking at what's going on in your body, having those tools.
Mhm.
Um, Sleep, movement and sleep matter so much. After we eat, even just 10 squats an hour helps tremendously to balance out those glucose levels. And I think I made everybody at the conference get up and do squats. So,
Yeah.
do it right now for sure. It helps tremendously. Sleep, of course, sleep matters, which is why we really put an emphasis on that progesterone. But those things together will stabilize our insulin. It'll improve our mood, help our energy, and then like I said, it helps those hormones act more gracefully too. So it kind of keeps them all in check. Again, like I said, we have some medications to help in short bursts. Like I like to treat because when our hormones go down, right, our insulin resistance automatically increases. So we're already fighting that. Why most women who are in perimenopause, postmenopause, that menopausal cycle get that weight gain right around their belly and it's so hard to go away, right? So every time you eat, that blood glucose rises. Your insulin tries to get into the cell to bring it down, but it can't because it's just bogged down with fat, if you will. Like those receptors can't uptake that insulin. So then every time you eat, that insulin just rises and rises and rises and rises. And that is what holds on to inflammation and leads us down to insulin resistance and the metabolic disease, PCOS, diabetes, prediabetes, diabetes, heart disease, strokes, all of the things we want to stay away from. So that's why I think the insulin is such a key game changer in our party, right? We really got to pay attention to insulin. Um, but yeah, so um, let's see. Our next one is our cortisol levels. Again, this is like a guy behind the scenes that can affect everything else, right? So this one's the warrior. This one's, like I said, peeking through the curtains, wondering if the cops are coming. Is it thunder outside? Is it raining? Like things, just very cautious about what's going to happen at the party. Um, so in short bursts, she's really protective, right? And when we are in a fight or flight, she comes out and she helps protect us. But the problem is when we are in a chronic fight or flight, then she just hijacks the party. Our sleep suffers, our tensions rise, snacks mysteriously disappear. We're trying to emotionally eat our way out of it. And that's her. She's to blame for that. So in our bodies, highly and poor cortisol can increase anxiety. Like I said, poor sleep, that midsection weight gain, and then just I'm always tired, but I'm wired. I'm always tired, but I can't fall asleep when it's actually time. That's our cortisol. So our tools then for that, this one's kind of hard. This one is probably the hardest one to control. Because our tools are mostly our nervous system hygiene. So, which Americans are really bad at. We don't get enough sleep. We don't calm down. We don't take our siesta nap. We don't rest, right? Because when we're busy, that means that we're important and that's what we're supposed to be doing. Um, but we really have got to set some boundaries as women, as moms, as caregivers. We need to set those boundaries. That consistent sleep and wake up times are really important for our body. The we need to get up and we need to look at morning light. We need to go out there, put our feet in the grass, and really feel like connected to the earth in order for our body to regulate itself. I mean, that's how it works. Standing on top of concrete all day long doesn't help us regulate our cortisol system. Um, Yeah, realistic to-do lists. We put way too much on our plates, and we've got to let things slide. That's going to help just bring down that fight or flight throughout the day, throughout the week, throughout the month and the year, and help us to re-regulate a little bit more. So the small, durable rhythms, like, just beat those heroic efforts, right? So like when the warrior calms down a little bit, then the rest of the party is able to party, right? We're able to actually have a good time. And a lot of that is going to be based on us. There are some like some supplements that you can take. Ersfeld has some. We also have some here. And they're from they're all over the place, but like a cortisol management. Those ones are really good to help kind of bring down those cortisol levels at nighttime when we're supposed to be going to bed. And how we test that, so at my clinic, we just draw a random cortisol level through your blood, just along with all the other blood work. And what we're doing with that is making sure that we don't have a big metabolic condition going on. There's Cushing's disease where we're either lacking, we have too much or too little of the cortisol steroid in our body. And so we test that, but in order to get an accurate cortisol level, we need it to be diurnal, which means that you do it 4 times a day. So in the morning, mid-morning, afternoon, and then before bed. And it's usually a saliva test. And we carry those here. Ersfeld also carries them. And that gives us a good picture about really what's going on with that cortisol level. We want those levels to be pretty high in the morning, right? So they start out high because we're anticipating our day, and then they sort of just kind of relax during the day. A nice little S curve. But most of us, it starts off really low because we're so exhausted from a poor night's sleep that our anxiety increases throughout the day, and then we're going to bed with really high stress levels in our body, and then that's why we're not sleeping either.
Mm-hmm.
Down to getting that good morning light in our eyes, regulating our system enough to know that it is morning and now it is nighttime, is really important in the overall cycle of our sleep.
Mm-hmm.
Yeah.
It's
And that's
cool to
probably one of
hear.
the harder things to do.
It's
What
cool
were
to
you
hear
gonna say, Phil?
you mention that, Megan, because Jenny and I actually just had a conversation about that this morning on
Oh,
Marco. We're just kind of checking in with the girlfriend getaway coming up. All of us are like,
yeah.
no, we can't get sick, or if we are sick, like we gotta, we have to do everything in our willpower to make sure that we're healthy. And so Jenny
Yes.
and I were just sharing some ideas back and forth. And one thing I told her, I was like, make sure in the evenings, you're putting your phone screen away or staying away from
Mm,
TV screens and things like that, and having that scheduled like wind down
Mm-hmm.
time so that you're able to
yes.
fully wind down. But then also in the morning, I shared with her to get out and get some daylight, some sunshine
Yeah.
first before even picking up her phone.
Mhm.
Obviously, that natural light is way better than the phone screen light. But I think even we're scrolling social media and we're picking up on
Oh,
all the,
yes.
all the extras that we don't need to. So that heightened cortisol right away too
Yeah.
throughout the day can start in the morning. Yeah.
Absolutely.
Absolutely. I mean, and that's such a good point with the screen times and just like the good sleep hygiene. I read an article the other day where she wouldn't pick up her phone for 3 hours in the morning. So from like the very beginning that she woke up, she wouldn't pick it up until 10 o'clock or whatever in the morning. And I'm like, wow, that must be nice. I've never had that luxury. But I mean, like, even so, even just doing something as simple as like an alarm clock that just, I think it's called the Hatch or something, but that will like put light into your room and wake you up that way versus an alarm clock on your phone. That's big. Even that makes a big difference. I mean, I've done an experiment myself, so it does. It makes a big difference, just those little changes like that.
Yeah, even Jenny mentioned just simply setting an alarm at night an
Yeah.
hour before bed, reminding herself,
Yeah.
like, okay, phone down, like the phone is going
Yeah.
away. So just those simple
Yes.
things to help you. Yep.
Well, and you
Mm-hmm.
think you don't need that like simple of a reminder, but how many times are you like, how did it get to be 10 o'clock? You think it's like
Yeah.
8:30. And so
Yeah.
you
Yeah.
need that alarm to alert you as is time. Because I looked up, one of my daughters is sick right now. And so I'm like, okay, use my AI that is like my best friend. I'm like, okay,
Yeah.
what's the number one thing I need to do right now to not get sick this week? The number one thing was sleep. And so that's, we were talking about this. She's like, you need that wind down time so you can get to bed early.
Yes.
Because
Yes.
we all know that there are we can get that sleep, but we have to really make it purposeful. You really do.
Mm-hmm. Yeah, the quality of sleep is so much better than even just the quantity of sleep, you know? So doing
Mhm.
anything that you can do to improve that quality, I think is a game changer. I mean, that's just where everything stems off of, right? So yeah, again, just a little heads up to our progesterone friend because we need that in our system, but we need to help it out too. You know, I mean, I can't do everything. So we've got to wind down that hour before taking a bath, relaxing as much as we possibly can so we know we're not in danger. You know, your body's not in danger. It's okay to fall asleep and get that restorative, good quality sleep. So, yeah, it's a good point. Okay, let's go back. So yeah, the thyroid. So the thyroid is our DJ. This one gets so much attention and it should get more. Honestly, it should get more. It is the one that sets the tone of the party. Whether it's too slow, the party drags, that leads into some fatigue, cold intolerance, constipation, hair and skin changes, that weight starts to creep up too fast. If the party's too fast, that's when we get those palpitations. We're at heat intolerance. We can't do anything in the heat. Anxiety creeps up, and then unintentional weight loss, which usually we're like, all right, but this side is way too much, right? A lot of like mystery symptoms that we just can't figure out until we get to that DJ booth. So to do this, we check lab work. We check a TSH, T3, T4, and we check antibodies here at our clinic. So what that means is that we're able to tailor the causes and the goals, right? So the aim is to make this like really nice, comfortable tempo within our body. So we're not feeling rushed, we're not feeling stuck, that fight or flight system isn't in overdrive trying to compensate. And as we get older, you know, women specifically, our thyroid starts to not function as well. You know, so whether or not our labs are showing that, these symptoms here that are on the screen can absolutely point to that, you know, that it is the thyroid has a lot to do with it. And so when our thyroid isn't functioning properly, our symptoms will kind of take over and we can compensate that way for a little bit, but then there's a point where it's going to go down. Thyroid antibodies, we check that because that is when our body is actually attacking our thyroid. So it's not that it's just not functioning properly, our body is attacking it. And so I think it's really important to rule that out right away because a lot of our symptoms, a lot of these symptoms can just be perimenopause. But like we said before, our thyroid is in this whole hormone cascade where one affects the other, affects the other, affects the other. So like unless we do a whole workup with the TSH, T4, which is usually what our modern medicine friends check, but we also need to check that T3, which has a lot to do with our weight gain and energy, and then our thyroid antibodies to see if we do have an autoimmune response causing more inflammation as well. And sometimes when that happens, you know, if we do not have Hashimoto's is what it's called. That's the hypothyroidism, the autoimmune hypothyroidism. Then we can go with levothyroxine. But typically, my favorite is going to be the Armor or NP thyroid. That's a desiccated thyroid, and that has T3, T4, and TSH in it. Where levothyroxine just has TSH and T3. And like I said, like our hormones can be our thyroid panels, our thyroid labs can be completely normal. But then if that antibody is elevated, well, that shows that your thyroid is compensating, but it's not doing too good anymore, right? Like it can only compensate for so long before it's gonna need some treatment. So if you do have some positive antibodies, which means that your body's obviously attacking that thyroid, we can also add on some low dose naltrexone that is compounded through Ersfeld Pharmacy as well. It just kind of blocks those autoimmune receptors, which decreases the inflammation and that affects systemically from that autoimmune attack. I love it. I use it for so many different things too, just because it is an overall pain relief, inflammation decreaser, just overall feeling better, right? Like it's got so many functions. It's really good. So, how do these all play well together? So, here's the big great outcomes come from balance. We identify what's missing, who's too loud, who needs more support. And then we layer in the foundations like sleep, nutrition, movement, stress regulation. And then we put targeted therapies like HRT, thyroid medication, and other supplements as appropriate. And like we kind of touched on earlier, perimenopause can start in our 30s. So it typically starts when progesterone is declining first, and then estrogen is kind of going crazy. And we can help these symptoms by kind of mimicking your cycle, right? So like we did with Jenny, where she was still cycling, where we gave just that progesterone and that we do days 12 through 26, kind of in the middle of that cycle. So that's when our progesterone is at its lowest, and that's where we really start to have symptoms. So we just added on there. But then in her case, like she's a perfect example. She was feeling so good on those days, but not the other days. Okay, well now it's time to increase to, one dose every day, and then we increase a little bit more on days 12 through 26 to still mimic a cycle. But the menopause, right, doesn't start until without a cycle. So there's only one day of menopause, right? And then you're postmenopausal. So that day it's been 1 year, that's menopause. The rest after that is postmenopause. We don't really treat any differently though. Once you're in that category, right? We still treat off of your symptoms. So it's not a one-time fix, right? It's like you were talking about, it's a conversation with you and your body and your provider. We nudge and we listen and we adjust. And then over time, that party, the party in our body becomes reliably good. It's not perfect, but it's sustainable, right? Like you said, 95. We'll take a 95% for sure.
Yeah.
So since HRT is like such a common question and so scary with all of those negative things out there, we're going to kind of talk about it a little bit. So think of hormone therapy as like inviting a responsible adult to supervision to the party. So everything runs smoothly again, right? Um, Current guidance supports starting within 10 years of menopause, or before age 60, giving the most favorable high risk or benefit risk outcomes. And that's just because the older we get, the more organs start to fail a little bit, right? And hopefully not. Hopefully we can catch it before then, add on the estrogen and all your hormones so those organs aren't failing. But we have to just be a little bit more careful. It doesn't mean you're not a candidate. It just means that we need to be more careful, and we need to probably watch you a little for the beginning of it. So benefits we usually see complete relief from hot flashes and night sweats. Definitely better sleep, improved urogenital comfort, so it's not dry vaginally. We're not having issues with sex, urinary tract infections, yeast infections. And we also get mood stability, right? Everything feels a little bit more normal. And then protection for bone health too. Our bones really. And like we talked about, risks, those can vary by route administration. The transdermal estradiol is my favorite because it reduces those blood clots. Of course, we can always do oral estrogen as well. I have our modern medicine friends love to start with oral estrogen. Not entirely sure why. But if you are doing well with that, that doesn't mean, you need to go and switch. If you're doing fine with it, we're not going to mess with what not broken, right? You're still getting the estrogen as long as it's still like that bioidentical estradiol and it's not Prempro. We're happy with that. If you have a uterus, you need progesterone, and if you want a libido, you need your testosterone back, right? So we therapy, and we try to get the least amount that we can with your symptoms being controlled. So just because you are on the smallest doses and guidelines say the lowest amount possible, well, that doesn't mean that we're going to go up or we're going to stay there if you're having symptoms still, right? We're going to treat you and your symptoms, not the labs, not just going off of guidelines. So yeah, as a perimenopause and postmenopause provider, and a caring human being at that, your goals really are my goals, right? So that's kind of what we talk about. I think outside the box. I don't just say no because of one study that happened. Follow guidelines and, all of the studies and yada, yada, yada. I went to school, I make it safe. I do all of those things, of course. But the goal of my practice here is to treat you and to get you feeling your best again, right? And like you said, it's not an overnight thing, but it is pretty quick versus all of the years that you've suffered, So yeah, for instance, let's talk about a patient. So let's set the scene. You're a 39-year-old. You have a husband, two kids. Over the course of a few months, you've started waking up at 3 to 4 o'clock every single morning. You're either too hot, you're too cold, or there's just no reason at all. You're just waking up at that time. But you notice that pattern, and then you're groggy all day long, but then it's hard to fall back asleep. And the cycle just continues and continues, and it just gets worse and worse, right? You also notice that you're really short-tempered with your kids, with your husband, and you definitely don't want your husband touching you. Nobody gets to touch you, right? Overwhelmed, overstimulated, don't touch me. So what are we happening? Like society's telling us we're crazy, right? We're crazy. We need to get some pills. We need to go see somebody, all of the things. But actually you're just perimenopausal, right? The bad news is that we have control for it, but the good news is we have control for it. The bad news is that it can last 10 to 15 years before you actually don't have that cycle anymore. But good thing is that you have me out there, right? We can get you feeling better. Life is good, and you start loving your life again. Again, you want to have sex, and you love your kids, right? So then periods, those start skipping months at a time. Suddenly you realize you haven't had a whole period for a year. So you're loving this at first, right? Like no periods, score, everything is good again. But then those naughty symptoms start coming back with a vengeance this time. So all of a sudden, that estrogen drops off the face of the earth. It's done. Your ovaries are shot. Your adrenals can't keep up. Hot flashes, a dry vagina, yeast infections, UTIs, zero sex drive again because it just hurts so bad. You can't sleep. The moods are all over the place. You hate you and the world again. So now you are menopausal, right? But lucky you, right? You go to me here at Urban Unwind or a provider so like me, and you have my email, and you just give me a shoot. You shoot me a quick update, and you're like, hey, we need to get things figured out again. I'm back to square one, right? So at that point, we need to put on an estrogen patch, right? Your estrogen's gone. Let's replace it with some estrogen. You no longer have to cyclically treat it because you don't have a period anymore. So you just take that progesterone daily. We slap on that progesterone patch twice a week. And then we move up and you start feeling so good. I give you that vaginal estrogen as well, so you're not dry as the desert. And it doesn't hurt when you're trying to be intimate, and life is better again. So it was a close one, right? I mean, it happens that fast. It really does. So you start feeling good and you feel like, you've got the key to being like, maybe 25, 28 years old again, somewhere around there, just feeling better, right? And then what happens is you tell your coworkers this, right? So you tell your coworkers and you start to feel that you're feeling amazing again. And then Deborah or Nancy, Karen, whoever's at your office, right? They're like, well, those cause cancer, right? So kind of like your experience, JennyLee, where you're like, nope, I'm so scared of that, right? But to say, but then you remember that your provider explained to you all of the myths surrounding hormone therapy. So I'm just going to kind of break it down here too. So, in the early 2000s, there was a study done called the Women's Health Initiative. So, this is where researchers took 160,000 women in their 60s and they all gave them a drug that they were trying to make money off of, right? Called Prempro. So, Prempro is Premarin and progesterone combined together. But Premarin is a pregnant horse's urine, right? So Premarin, it's a conjugated, it's a synthetic estrogen that they've got it from a pregnant horse, right? And then they're putting that in our system like that's the same. So no wonder when they all of a sudden had all of these horrible contraindications and dangerous outcomes because our body had to like really work really hard to convert the synthetic hormones over into something that we can use. And then we had to detox all of the bad stuff and it couldn't detox. And then it just kind of bundled up in our system and then led to chronic diseases, right? So that's what happened. So in 2002, the combined progesterone arm was stopped early because there was increased breast cancer risk. There was some strokes, clots, and heart disease. So they labeled all hormone treatment just real dangerous. It told doctors to avoid it altogether. A million women suddenly stopped hormone replacement therapy and then they suffered, right? We were talking about like the dementia, risks were too high. The colon cancer rates came up, osteoporosis, vaginal cancers, and breast cancers and endometrial cancers all stayed the same though, which was weird. So it doesn't really make a whole lot of sense.
So
So
those
here's
other,
what's
the first ones you said came up after they quit their hormone therapy. Yeah.
Yes. Oh,
Yeah.
yes, absolutely. So like they were on hormone therapy, they were doing fine, and all of a sudden they stopped everything. And then, mom and grandma couldn't remember one thing,
Yeah.
so the dementia risk went up by 90%, colon cancer skyrocketed because there are estrogen protection against all the cells in our body. Heart disease worsened, osteoporosis, all these really horrible things that we can avoid by just keeping our hormones balanced, you
Yeah.
know. So here's what's wrong with the WHI trial. So the age of participants for number one. So the average woman in the WHI trial was 63 years old. I wish it was 63 degrees, right?
Right.
63 years old. And many were 10 plus years menopause. So like we said, it's not that we can't treat them, but their risks are obviously elevated. Benefits just may not outweigh those risks. They're within that age range and being so far away from menopause. Baseline health. So a lot of those women enrolled in the study already had cardiovascular conditions, which led to just some real biased results. And then the type of hormones they provided, like we talked about the Prempro being synthetic. So the results didn't represent younger, healthier women who typically could use that hormone replacement therapy when suffering through peri and postmenopause. So the summary of what we learned with this trial is that women who start hormone replacement therapy before age 60 or within 10 years often have reduced risk of heart disease, diabetes, fractures, and mortality. So that's saying like the earlier you start and continue on with that hormone therapy in your body, the less all-cause mortality and issues and chronic disease you're going to have down the line. ACOG, the American Community of Gynecology, the Menopause Society, and the Endocrine Society says that hormone replacement therapy is the flashes, night sweats, vaginal dryness. The benefits outweigh the risks so far for lots of women. And like we talked about too, those synthetic hormones, we learned that those are the cause of these women-driven cancers, right? So that is a foreign object in our body. Our body is going to try to detoxify that, but it doesn't have the means to detoxify it unless we actively know that we need to. And then it leads up to toxins in our system, and then that's what leads to chronic disease and cancers. So this is an excellent book by Dr. Avram Blooming and Carol Tarvis, I think is how you say Tavis. The book argues the fears surrounding hormone therapy after the Women's Health Initiative trial. Like I said, it was misguided and harmful. So it makes the case that for many women, specifically those on hormone replacement therapy near menopause, estrogen is not the only most effective treatment for hot flashes, night sweats, and vaginal dryness, but it also reduces osteoporosis, heart disease, diabetes, and dementia. So not only does it prevent a bunch of things as far as cancers and your symptoms, it's also preventing some chronic disease, which is huge, right? It's not just a symptom it's not just a symptom band-aid, if you will. It is actually treating some underlying causes of our chronic diseases.
That was
So go ahead.
that was a turning point for me. Like even before
Yeah.
I had came to see you, I heard that like that it can actually prevent or osteoporosis and dementia. And like I said, my husband was like getting worried about my mind. And then you repeated that same thing to me, and I was like, what? Like that was like a
Yeah.
game changer of like, okay,
Yeah.
tell me more about this. And I will tell
Yeah.
you that I don't know, Nikki and Shelby might remember too, but I think it was a month maybe that I was on it, 6 weeks, and he was like, yeah, your medications are helping. Like he knew
Oh,
my brain was that much better, that much faster. I mean,
yeah.
and it
Oh,
continued to get better, but he seen the difference probably before I even did.
wow. I
Yeah.
mean, that's huge, right? And
Yeah.
I mean, I mean, everybody gets to speak for themselves, right? But like for me, that is almost as scary as cancer. I do
Yes.
not want to be demented out of my mind by, my 60s and then not enjoying the rest of my life. That is absolutely a no-go for me. So yeah, I might take a little bit of risk with that C word over just being not me. either, you know. So, but everybody, that is the brilliance of my practice too, is that we educate you on those risks and those benefits. And we really believed in informed consent. So I think a lot of providers treat as though I am protecting you by not giving it to you. But here we're like, let's work as a team together to identify what is more important. Right. So, yeah, I feel like that's how medicine should be, but, you know, that's just me. So, but yeah, what is really great about this book too, I suggest everybody get a copy of it. It is so good. But what it does is Dr. Abram, he is an oncologist who treats breast cancer. So he found with his patients, they were actually more miserable going through the chemical or chemically and surgically induced menopause than they were actually going through chemo and radiation therapy. So because after most of the guidelines show once you like a breast cancer or an estrogen progesterone kind of receptor positive cancer, the means to stop that is to get rid of all your hormones, right? So then these women all of a sudden were just null and void, right? They were not themselves. They did not feel good. Nothing was going right. And they were more miserable with that than actually going through their chemo and radiation treatments.
Oh,
So he kind of found out that putting putting or taking away hormones from women is just as hard as on our body, if not worse on our body than going through some medical necessities, right? Which is hard. That's hard for us to go through. Um, so yeah, like we talked about, estrogen to protect so many cells in our body, our brain, our colon, our bones, our heart, metabolic and reproductive system. I mean, it's endless. So you take this away from women and we destroy the women. So what he found was adding that on actually decreased their all-cause mortality. So he started putting women on estrogen and progesterone instead of taking it away from them and high doses of that. He started putting them on high doses of estrogen and found that they did so much better through the cancer treatment and had less reoccurrence. So if estrogen and progesterone cause cancers, then how is that? You know, why does
Mhm.
that make sense?
Right.
So I think it was really great that he kind of looked into that.
Right.
But yeah, the C word is like nobody wants that. It is so scary. We have come so far in cancer treatment, especially for breast cancer detection and early findings. But it is still scary. So it's
Yeah.
not that hormone therapy gives you cancers. It's that if we have cancer driven cells in our body, right, which has a lot to do with our environment and how we eat and what we're doing and how we take care of ourselves, then that cancer the estrogen and progesterone we give you, right? And then that's going to fuel and that's going to come to light, which is why I really stress the importance of regular monthly self breast exams, mammograms, pap smears if you still have a uterus and cervix. But yeah, well, hopefully we can catch it early if it does happen, because it does unfortunately happen. And then it'll be a lumpectomy and we can kind of get on with our lives, right? Without very little like hormone related issues down the line.
is
Mhm.
So.
there is there any proof and like, and if you, I don't know if you can answer this or not, but that they would have had, like, somebody who's taking some estrogen and then gets breast cancer, that they would have had that breast cancer with or without taking
Right. There
estrogen?
is kind of no proof, right? So it's like we don't know most of the time it's that we have that cancer inside of us, right? We're already growing those cancer cells and we've had estrogen and progesterone our entire lives. So if it was because of the estrogen and progesterone, then we really should be having lots more cancers during pregnancies, right? Because that's when they're at their
Mm.
peak. So it doesn't really make sense that when our estrogen and our progesterone start to decline, those cancer rates all of a sudden go up, right? The
Yeah.
later in years we get. So it's not really there's no correlation and causation there.
Mhm.
Yeah.
Well, and I'll
Yeah.
just share my experience. I mean, I do have breast cancer in my family, and that was a conversation that we had when we met. I also have had some scares of having, I had to have a biopsy, and every 6 months I have to go in for a mammogram and things like that. But for me, and we had that discussion before we said what we were, what we decided to do. But I was like, I didn't know all of that. I mean, you shared a lot of that with me, but didn't go on to that, but or from there, but just thought to myself, you know what? If that's in my future, I need to feel like me. I need to be able to have that fortitude to say I'm going to fight it or whatever that may be. And it's not that we just set it and forget it, right? I know that's something that we have to constantly be checking on, but for me, it was worth it. So many things that you just talked about. Oh, there were so many things that, I mean, we probably could talk 2 hours. But
Oh, yeah.
so JennyLee was talking about not, that cognitive part. And I knew that the brain fog for me was huge after a loss of my child. And it's still been something. And I had even gone to other providers and said that. And, they're like, did you talk to anybody else about it? I'm like, well, dear God, I didn't want to bring it up with anybody else because I mean, nobody's brought it up to me, but are they behind me saying, going like, oh my gosh, that girl, she can't even remember her own name, you know? And being a psychologist by training, I was scared. I was scared that that was um, what's wrong with me, right? I mean, I think that's a lot of what happens with us women. What did I do to cause this, you know?
Yeah.
And so, and I'm just gonna kind of like talk about some of those, a few things. I mean, I definitely have JennyLee and I both dove in and did a lot of research, both of us, and we just get on Marco back and forth and talk about all the things that we found and like, oh my gosh, did you see this or did you read that or send
Yeah.
it to each other? But I think the other thing that I had read that really hit me, and you talked about it, is the estrogen decreasing, and that increases the Alzheimer's chance. And so we also
Mhm.
know that that's related to the insulin and all those different components.
Yes.
And
Yes.
I think you talking about, there's no wonder drug. We know, I mean, most of us know that, right? It's not like we're going to get on something and like the next day it's all better. I mean,
Right.
even I too we started one place and then we adjusted after that. And I was going
Hmm.
to touch on with me, even though when we did my labs and I said I was tired and things like that, and when you talked about, a normal T should be anywhere from 20 to 30, mind you, mine was a 1 or less than 1. It had the less than 1, right?
Yeah. Yes.
And I was like, you know what? Because I like statistics and variables, I just want to do the estrogen and the progesterone first and really
Mhm.
see where I feel and or what that feels like. And then, after I got that on board for some time, then you had said, I really think after we did another lab check and checking in where I was at, but I was still tired.
Yeah.
And I got the testosterone on board, and that was a that was another game changer for me.
Yeah.
I don't need, if you're one of those people that are out there that I would drink my coffee in the morning and then have a Diet Coke or a Diet Mountain Dew or whatever it was in the afternoon, and maybe one in the evening. I have my coffee in the morning still. That's like still something I like, right? But
Hmm.
I find myself like I don't even I don't even have the craving for that in the afternoon.
Yeah.
I
Yeah.
have the stamina. I have I don't feel tired. I'm not yawning all the time or being like, why am I so tired? Right? I
Yeah.
don't
Yeah.
have that. And that I would say for at least the last, I don't know, anywhere from 5 to 7, 8 years, I was definitely feeling that drain, but we just know that we have to get so many things done. So we just put our head down and keep doing it.
Yeah.
And we look around and other people are saying they're tired, right? That are about our age or even new mamas. So we're like, well, man, I shouldn't be complaining, everybody's tired. But then realizing that isn't normal. That isn't normal.
Right.
Actually, I mean, yes, we can feel tired because we had a big day, but that overwhelming sense of dread and like your feet are in, I always
Yeah.
I likened it to like being in quicksand. The more I moved, the farther it dragged me down. And because
Hmm.
I just kept going, I thought I had to be faster. And I was doing the movement. I was taking care of my nervous system. And for those people out there, maybe they aren't doing some of those things, but that doesn't mean you have to do all those things first, right? Coming to a
No.
provider and saying, okay, what are you doing? Now let's talk about what things we can incrementally add in. I didn't
Mhm.
ever feel like you said to me, well, all those things have to be in by the end of
No.
this week or the end of this
Right.
month, right?
No.
And
Gosh, no.
I think, right. So I think that I mean, because we've gone through a lot of information today, and
Yeah.
hopefully people have, and everybody's different. I think the biggest thing I wanted to not forget to talk about that either is that when you were talking about like the estrogen patches, I think it happened to
Yeah.
both Jenny Lee and I. Our pharmacy gave us they gave us the generic. And so they were, let's say they had this generic for this a couple months, and then now they
Yeah.
switched to something else. And all of a sudden I was like, had a little bit of, I'm like, ooh, something's, I remember, I think I even
Tough.
shared with, yeah, Jenny Lee and Shelby. I'm like, I
Yeah.
said something that came out of my mouth over Christmas. And I remember even saying like, did that just come out of my mouth? Did that was actually out of my brain, or did I just think, oh no, I had said
No.
it? And I was like, oh my gosh. And then we started talking and I realized, hey, I've been using a different estrogen patch. It
Hmm.
says it's the same amount, all the things, but I'm like, but the last 2, 3 months I've felt a little bit not the
Yeah.
same. And so then that's when, each of us reached out at different times and not realizing what it was. But you saying to us, or to each of us individually,
Mhm.
even though it's the same amount, right? They might use a different glue or they might use a different plastic or whatever it is, and something in that with my pH or my body. And
Hmm.
so I think that's the biggest thing that I want to say is like advocating for ourselves. I think
Yes.
we think that that's bad. We think that it's often selfish that, well, my grandmother went through it, my mother went through it. Why do I think that I should be any different? Because we deserve it. You know why?
Yeah.
Because if
Yeah.
they had it available and they knew what we knew now, I guarantee you they would want us to have better.
Yeah.
And I want
I
better
agree.
from, the women that are going to come after me.
Hmm.
And so I think that's the biggest thing is advocating and saying, no, I am not feeling good, or
Yeah.
sometimes I am and sometimes I'm not, but really understanding that what I say a lot of times, no one's coming to save us. So
Right.
we have to speak up for ourselves. And really, that's why
Hmm.
we wanted you to come on today, is just to start to
Yeah.
shed the light on, people realizing that this could be happening, like you said, anywhere from 10 to 15 years before you have menopause. So that could be anywhere from, for some people, 30 to 35, or
Hmm.
40. And so
Hmm.
they're thinking they're in the prime of their life, and not
Yeah.
knowing when you said that you have the life we prayed for, I
Yeah.
know that because I have that sign in my bedroom.
Hmm.
And I've gone through loss and things like that, but
Yeah.
I wanted to feel good. I
Yeah.
still want to have those times where we feel good, and we are, that's an okay thing to want and not think that it's
Absolutely.
only for those people to have. So,
Right. No,
um,
absolutely. And I think just to kind of point into another point too is that like we're up here in North Dakota, right? And so a lot of our health system too is just a tish behind. And
mhm,
most of the country is already doing this, and I don't feel like I mean as providers, as doctors, as people in this position to help make or to make decisions, it should be helping and guiding and giving conformed consent um and doing like showing the evidence of this side and this side, not just automatically assuming that I'm not doing that because I don't like it, and I just think it really does a disservice to medicine nowadays, and that's why a lot of people are headed towards these hormone therapy clinics and these wellness clinics is because it's somebody who recognized that and really want to listen and
mhm,
help you advocate for yourself, like I want people to come in with lists, come in with a list. Let's check it off. Let's go.
mhm.
I give people my email and I check it constantly throughout the day so you don't feel alone in it because you
Yeah.
shouldn't.
Yeah.
Yeah.
And I think the other thing that we've even had to remind ourselves, not with you, but sometimes you feel because you go to one provider, or maybe that's the provider you've gone to since your first baby, or whatever. Because actually, that's a conversation that I just had recently with someone. They're like, I've gone to this person for this, and they've been wonderful, and then I went to this person for this, and they've been wonderful. But now I'm in this stage of what we're talking
Yeah.
about, where the inflammation in their body, I mean, we didn't even really go down that road, but that was one of the biggest things for me was inflammation.
Yeah.
I mean, if I crossed my legs, I had a huge indentation because the inflammation was just rampant in my body, which I
Hmm.
know I'm not the only
Hmm.
one, but and so those people were great for them for those other issues. And I said, but it's no different. Like if you go, I'm not trying to liken it to that, but if you go to buy a car and that person that's trying to sell you the car is a jerk, right?
Yeah.
Or they don't have what you need, what do? You go to the next dealership or you go
Yeah.
online or whatever you do. And so I said, it's the same with providers. You
Hmm.
don't have to, if that's not their area of expertise, move on. But I think we
Right.
sometimes feel, like you said, more rural North Dakota, different things like that. It's like, well, but they're the only person, right? And it's
Hmm.
like, well,
Hmm.
we would drive to go to Bismarck for Costco or Sam's Club. So why is it not okay to drive to, 3 hours for,
Yes.
or 2 hours or 1 hours for an appointment for our own well-being? But
Right.
sometimes we
Right.
just don't see that equation. And I'm like, but
Hmm.
our health and our well-being, because I really do believe, I actually read something not so long ago. It said, isn't it interesting how the woman, the female in the household, can set the tone for their
Yeah.
life? And
Yeah.
I mean, you can look at that lots of ways. I mean, we can be like, of course we do. But
Yeah.
also we could say, oh, yes, we do.
Mhm.
Right? And just saying that in a good way that then if we're setting the tone and we're unhappy and we're not feeling well and stuff like that, that sets the tone of that environment. And if we want something better for our children and for our husband, then we should want that for ourselves, right? So
Yeah.
I think that's
1000%.
yeah, I think that's the reminder that because we often put ourselves last, but we have such an influence on all of the things, all the planets that are moving, in our world. And why shouldn't we
Yes.
have that care that we would want for anyone else? Yeah.
Right.
Megan,
Right. Like
I'm sure we're getting close to wrapping up here, so I just
yeah.
wanted to ask um, for listeners that are maybe like looking into this, or if they have further questions, and they may or may not have access to you. But
Hmm.
what are some questions that they could take to maybe their current provider,
Hmm.
or what are some things that they can research for themselves so that they are finding a provider that would work well for them?
Hmm. Yeah, that's a good question. I think that this medicine is is really up and coming. At least in our region, like in other regions, it obviously is a little bit more available. But I think here, there are so many options and providers that are trying to involve themselves into that conversation. Um, I mean, they can always, of course, start with modern medicine and get labs drawn. But most of the time, just a simple Google search and word of mouth is where it comes from, to find the people who are actually specialized in it. I don't know if like ROB gyns will refer to me or not, but they certainly know that I do a lot of this work. So I think it really just depends on word of mouth and Googling it. There's these topics are really coming up, and I'm just trying to get the word out about North Dakota actually getting involved. But yeah, and really what you want to look for is somebody who treats hormones and get a good feel when you go to their office that they are in it to treat you and they just aren't slapping this on you and calling it good, right? The point is, I mean, that's a good starting point, but the point is to make sure that the people are following up and have access um, to get those questions answered and to get those symptoms resolved.
So to follow
Right.
up on
That
that,
was, oh,
yeah, go
sorry.
ahead. I was just going to say that same thing, Shelby. Like, what are the buzzwords? Is that what you were going to say? Like, what are the things that they should put into Google search and things like that?
Oh yeah.
That, and then also if you could answer for maybe women that have gotten labs drawn and they were told those things like, your thyroid's good, there's nothing
Yeah.
wrong with you, go about your day. But they're still having those feelings of like, man, I really don't feel like myself. How
Yeah.
can they, kind of move on from that and get the care
Yeah.
that they deserve?
Yeah. So you can go on, there's a menopausal society website that you can go on that we are a part of. And so most providers who have gone in and done the research and done the things can go on there and then just, type in North Dakota or type in your zip code and hopefully it'll come up with some providers. I mean, I know there's so far and few in between here. But some of the buzzwords that you want to look for is hormone replacement therapy, compounding pharmacies. That's a really good one. If you look into a local compounding pharmacy, you can really just call them and see who they work with. I mean, that was word of referral for me from Ersfeld Pharmacy for the longest time, until I started getting my name out there. So they will refer you off to somebody that they work well with, and that does a lot of the things that they do. So I think that's a really good point. But yeah, hormone optimization is really important. And then of course, looking at reviews. Go in
Mhm.
and look at reviews of that provider that you scheduled with or that place that you are looking into because you say so much about a place. And I mean, there are some sketchy med spas out there that, will just try. That's not, of course, what we want to be affiliated with. And I think that their reviews and doing your own homework and research on that is gonna help you out more than anything. But like you said before, advocating for yourself. So when you go in and you get hormone labs and they say that they're normal, but you still don't feel normal, and you're not okay with just slapping an antidepressant on and increasing it month by month, Google, right? Like go in and look, go to YouTube, go and do your research like JennyLee did before she came and saw me. Come in with the questions. I don't know everything, but I am more than a lot of women who care about women should have that thought process.
Yeah. Do you
Um,
have any other, oh, good. I was just going to say, do you have any other questions, Jenny Lee or Shell?
well, I wanted to ask almost and like for Shelby. Shelby is just like mid 30s. So, if you're
Yeah.
at Shelby's age and
Hmm.
we are talking about this so much more now, like Nikki said, than our moms ever did and our grandmas,
Yeah.
no way would you talk about that. But so now if you're like in your early to mid 30s, what are you looking for? What are the first signs that are like, I should check into this before you get to
Yeah.
the point where you're like, I'm losing my mind?
Mhm.
Yeah. Yeah. Good question. And I mean, unfortunately, but fortunately, everyone's going to be different, right? So, I mean, some people don't experience anything until all of a sudden that estrogen drops and they've got full-blown criteria for menopause, right? Some people as simple as like they have itchy ears or they feel palpitations every once in a while or they're not sleeping as great. I think to zero in on us, right? Really know our own bodies and what is different than the norm, and realize that there are ripple effects if we don't take care of it, the sooner the better, right? And so going in and asking those questions and not being okay with just like your normal goodbye answer, ask the questions, do the research and be an advocate for yourself because it isn't it is normal, right? Like that's the way God made us, actually. It is normal for our bodies to have that, but that also doesn't mean we need to suffer either, you
Mhm.
know? So
Yeah.
I get a lot, oh, my provider said that my estrogen was normal for being, well, yeah, it is normal for that, but that's also why you have A, B, C, all the way to Z symptoms is because you don't have that. So I'm not going to drag you down and slap a patch on you for sure, but I'm going to educate you why it's important to look into those options. It can keep you away from chronic disease, hospitalization, skilled nursing homes, all of the things that we don't want to go down anyways. So there just any symptom that isn't normal for you and that is worsening and impairing your every single day needs to be investigated.
And that
Mhm.
you said something that was huge there. And Nikki and Shelby and I have all talked about this, and working with Shelby as my wellness coach over the past few years too,
Yeah.
is knowing your body, like
Yes.
really paying attention to your body.
Yes.
And when something is off, questioning it. I mean, we all have off moments. We all have, days and things, but overall, just knowing something's not right. I don't feel like myself. And I think getting to know yourself, and that's hard when you are young and you're a mom and you're chasing kids and you're here and here. You don't even have time to think about what's going on in your body.
Yeah. It'll take a minute.
Yeah, we take care of everybody else, but I think just making ourselves more aware of that, and if we can start to do that when we are younger, so that way as you start to progress, even if it's once a week, you take 5 minutes with yourself, a check-in. How am I feeling right now? How has this past week gone? Taking your own temperature.
Absolutely. That's huge, right? Like one of the things that we learn in nursing school, NP school, and I'm sure they learn in medical school is like, you have to know what is normal to identify what is not normal, right? So like you have to know what's normal for yourself versus what isn't okay. So if you've had a degree of anxiety your whole life and it hasn't changed yet, well, it's not necessarily something we need to treat then, unless it is bothering you, unless it is becoming an issue, right? So know what is your baseline and what you're not willing to budge on.
Yeah, absolutely.
Mm-hmm.
Wow.
Did you have
Go ahead.
So good. Did you have more, Megan, that you wanted to go through?
Not really. It was next. So just those party rules. So again, it all comes down to just knowing your body and making sure that you just keep your eyes and your ears out, and so you know who to ask those questions to. You know who you can be vulnerable with. As far as your friends and your neighbor, whoever it is, the random stranger on the street. As long as they know that as long as they can point you in the right direction and where they can tell you like it's okay to advocate for yourself and to go out there and ask. It's okay.
And
it's okay to push for those things.
And hormone replacement therapy just had a huge overcoming. It was in the news, I think, even since the last time we heard you, when you did this at Nikki's conference. Do you want to talk about that real briefly?
Yeah, well, they took off the black box. There used to be a black box warning on all estrogen products. And so they took that off because really there is no reason to have it. So, it was saying that estrogen can cause blood clots and it is black box warnings are basically like a heads up to providers not to prescribe. Right? Like there are some major contraindications. Stay away if you can. And they've recently took that off of all estrogen products. So we're very, very happy about that. There are some major key players and women in hormone therapy that all have really great Instagram accounts and have a whole following. And they're really doing so much advocacy on testosterone women or testosterone therapy in women. That's not covered by insurance yet. And so there are so many cool things on the horizon for hormone replacement therapy and for women's health in general. So there's going to be some big changes out there with that.
I'm excited for our generation and the generations to come. It's very great news.
Yes.
Yeah. Well, I just want to say thank you so much, Megan, for taking time out of your day to spread the word and do the advocacy that you're doing day in and day out, whether it's in the office or, on the sidewalk or wherever, or here on the Real Joy Project, because these are the conversations that need to happen and they need to continue. And they're so important for, like I said, like JennyLee just said, our generation, but also the next generation that's coming up and to have that connectiveness amongst us all. So thank you so much.
Yes. Well, thank you for having me. It was such a joy. And like you said, I can talk for hours and hours and hours about this conversation. So I'd be happy to come back at any time.
Right. Awesome. Shelby, do you have anything?
No, thank you so much. It was really great to finally meet you. Maybe I'll meet you in person someday.
Yeah, for sure.
I'm all the way down here in Texas, so I do make random trips to North Dakota because I do have family up in that area.
Okay, good.
But
I'd love you just to stop by, come get a massage and a facial from us, and I'll say hi for sure.
Yeah, I would love to pick your brain someday about postpartum and hormones and all of that, which is obviously a completely...
That's a different roller coaster, my friend.
Yes. Maybe another day's call.
Yes,
for sure. But thank you so much for taking your time with us today.
Yes, thank you.
Thank you, Megan. And I'm going to we'll collect some of those websites and stuff you were talking about so we can tag them in our description here below. So
I think I got some there.
Great. If you guys if you're listening, check out the description to kind of gather some of that information. Leave us some comments or send private messages if you have any questions and stuff for us. And make sure to like our video and subscribe to our channel so you don't miss our future conversations. And
Thanks for
thank you,
joining us.
everybody.
Thank you.
Have a
Bye,
great
thank
day.
you.
Thank you.